Medicine Senior Center in Montgomery County. According to the state, there were 16 deaths and 40 cases at the facility, which only holds 35 people. But staff there say the death count is just plain wrong. Only 3 people died of COVID since the pandemic began. And they say their case count looked high because they cared for COVID patients discharged from Lankenau Hospital, whose campus they share. Meanwhile, CEO Carol Irvine says they were asked to report data to 7 different sources.
We're only second to the Nuclear Regulatory Commission, most regulated industry in the United States. And unfortunately, we were also part of the healthcare sector with the least amount of funding.
A number of facilities reported data errors, and the State Department of Health has said it is working to reconcile them. 2/3 of COVID-19 deaths in the Commonwealth have been among nursing home residents. Nina Feldman, WHYY News.
The New Jersey Department of Health has shut down a gym in Belmar that reopened this week despite orders not to from the governor's office. The owners of Attila's Gym arrived to find the closure order pasted on the front door, as well as posting from the Camden County Division of Environmental Health. Owners call it a dirty tactic by Governor Phil Murphy's administration. They had already been ticketed this week for violating non-essential business closure orders. Earlier in the week, a patron of the gym was arrested when police were speaking with him, asked for his name, and he refused to give it. The organizer of a protest outside the gym was also given a ticket for violating the state emergency order against large gatherings. And the process of releasing Philly prisoners during the coronavirus pandemic is slowing down. Kira Bradford Ray leads the Defender Association of Philadelphia. She says there are fewer cases that fit the criteria of an emergency order designed to limit the spread of COVID-19 behind bars. Forecast today going up to a high of 70 degrees.
For more than 2 months, workers have been risking their own safety to keep the country running. From hospital workers to grocery store clerks to delivery drivers. And so to keep their workers from quitting, companies like Amazon, Walmart, Kroger, CVS, and Starbucks are providing their low-wage employees with small, hourly $2 to $3 raises or one-time bonuses. Some companies are calling these pay increases hero pay. It's also known as hazard pay. Now, as many states are reopening, potentially putting some essential workers at an even greater risk, a number of these companies, including Amazon and Kroger, have announced they will be ending hazard pay at the end of the month. Others, like Target, have said they'll also end the practice within the next few months. This is leaving workers in a precarious state. They will still be doing hazardous work. I'm Matt Katz, in for Tanzina Vega, and that's where we start today on The Takeaway. Joining us now are Ben Steverman, a reporter for Bloomberg, and Molly Kinder, a David M. Rubenstein Fellow at the Brookings Institute. Thank you both for joining me.
Thanks for having us.
Molly, before COVID-19, who was hazard pay typically reserved for?
So hazard pay has a history of being associated with dangerous duty. So military service, people in the military service receive hazardous duty pay when they're overseas fighting in war. Some federal government employees are entitled to hazard pay when their jobs become dangerous, or in certain very high-risk industries like in mining, hazard pay has existed. This is a whole new ballgame because millions of workers in jobs that we didn't even think of as risky or hazardous at all have suddenly become so because of the pandemic.